Hi, I'm Bob Auerbach. I'm an advanced practitioner of Rolf Structural Integration, also known as Rolfing, a form of deep tissue, structural, and postural transformational bodywork. Sometimes I'm asked, what's the youngest person I would work on? Well, personally, I've worked on children as young as 5, and I've actually watched the work done on infants, 2-year-olds, 6 months old. Sometimes the work is even done immediately after birth. Now, you might wonder, why would you want to do such a deep process on someone that young? Why would you even need to? Well, very often, just in the process of the birth process itself, there can be distortions and torques that come into that child's body by the time they actually are born. And the sooner that those can be resolved, the better for that child, because then they don't spend all those months and years growing and developing around old, distorted, and unfriendly patterns, and patterns that are not supportive of them. I've actually watched the work done on a 6-month-old once. Now, this infant, whenever he was set down on his stomach, would panic, really, because he couldn't lift his head up to see what was around him. And the practitioner worked on him for maybe 4 or 5 minutes. Set him back down. He was smiling. He was happy, because now he could lift up his head and he could see everything that was around him. That makes a world of difference. I also watched the work once done on a 2-year-old. This was in a workshop situation. And that 2-year-old had some developmental problems in his legs. Now, walking was fine, but whenever he tried to run, he was very awkward. Again, the practitioner worked on him for a very short period of time. With kids, you really don't need to spend hours and 10 sessions. This is work that can be done very, very quickly. Maybe 2 or 3 sessions, maybe 5-10 minutes per session. So she worked on this child for maybe 5 minutes, set him back down, and he took off running around this large room, giggling all the way. And then he made a beeline back for the practitioner, threw himself in her lap, and just to thank her, because he got what a huge difference Rolfing can make. Thank you.